Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Welcome to the Swain Sinus Show. We're going to do something a little different. Today I'm going to be the host of the show. Our normal host, Stacy Wellborn, has been managing the Focus Women's Conference, and she's not available right now, so I will do my best to try to fill her shoes. Today, we are welcoming Dr. Jennifer Adair to the Swain Sinus Show. Dr. Adair is a pediatrician at Children's Medical Group in Mobile, Alabama. She attended medical school at the University of South Alabama. She attended her residency at the University of Nevada and at the University of South Alabama. She's been in practice in Mobile for 5 years. And I just wanted to take a moment to say that this is something that I think is very, very important. The role of vaccination in preventing disease is very important, but specifically the role of the human papillomavirus vaccine is really becoming a very hot topic in the medical literature. This is not a vaccine for sexually transmitted diseases. This is a cancer vaccine. I wanted Dr. Adair to be on the show today because I really think she is a great resource for learning about the importance of vaccinations. Welcome, Jennifer. Thank you so much for coming today.
Thanks for having me. I'm excited about this.
We are thrilled that you are actually able to make it here as a busy mother and wife and physician.
Yes.
We feel honored that you could take the time to join us today. So this is a new segment of our show, really, at the Swain Sinus Show. And what we really wanted to talk about today really was the role of immunization. This is more of a public service message. Not everything in medicine is treated with an antibiotic, and certainly there is a big push for preventative health care. And this is probably one of the biggest things, wouldn't you say?
Vaccines are probably the biggest advancement in medicine. I mean, it's amazing just since vaccines have come out, the number of deaths that have been reduced or the lifespan for people has improved. And it really is probably the single biggest advancement in medicine.
Now, you have a unique perspective on this, don't you? You're a member of the, let me make sure I get this right, the Alabama Vaccine Advisory Committee. Mm-hmm. Can you tell us a little bit about what that is?
Absolutely. So this was just started a couple years ago, and it consists of some pediatricians, some family practitioners across the state of Alabama, working with the Alabama Department of Health to try and improve not only our vaccination rates in the state, but also to improve awareness and get the correct information out there, because there seems to not be as many avenues of physicians speaking up about this, except when you're in one-on-one with your patient. But otherwise, there's not a whole lot of presence in social media or any other places across the internet to really discuss the improvements and benefits of vaccines.
Yeah, I would agree with you. One of the biggest things that we're seeing in changes in the ear, nose, and throat literature and the otolaryngology literature is a big push to have conversations with patients about immunizations. And specifically, one of the things that you and I have talked quite a bit about is human papillomavirus. There's a big article that's actually sitting here in the studio in front of me talking about the role of ENT doctors in helping eradicate human papillomavirus. And one of the things I was going to just talk to you about vaccines really is, what is a vaccine? A lot of people, there's a lot of information, there's a lot of misinformation out there, and that's one of the goals of our show today really is to give people a small little segment of what's the real information, what do they need to know? And specifically, we'll start with what's a vaccine? And most of the time, I would think that children are getting vaccine is through their pediatrician. Wouldn't you agree?
Usually, yes. Pediatricians are definitely the main ones giving vaccines because that's our bread and butter. It's our job to help set these kids up for a healthy, long life, and preventative medicine is a huge part of that. Going back to your question, what is a vaccine? It is basically a concoction of either a virus or bacteria, whatever you are trying to prevent the child or person from getting. And most of these are what we call dead vaccines, which means that it's just strains of proteins of whatever virus you're trying to target, chopped up into little pieces so that the body is exposed to it without actually getting any of it. And so what that makes the body do is the body then sees these proteins and makes an antibody to it so that if months or years later you are exposed to this virus or bacteria, your body already recognizes it and the immune system can go ahead and fight it off before you get any symptoms of it.
Yeah, I think that's a great explanation of it. A lot of patients in modern times really are not familiar with some of the things that vaccines take care of. I mean, we don't see some of these illnesses. Now, there's been a resurgence of some of that, and I think we're going to talk about it, but measles, mumps, rubella, diphtheria, polio, a lot of these things that were the scourges of mankind, we don't see a lot of anymore. When we do see it, it's really, really rare. It's unusual because of the value of vaccines. So when do kids get started with the vaccine? What's the earliest vaccine you start with?
So the very earliest vaccine is the day that they are born. They get the hepatitis B vaccine. And so it starts as early as then. And then usually over the next 18 years, they'll get several vaccines, and they're usually spaced out so that it's a safe amount so that the immune system is not exposed to too much. But you also want to make sure that they get these vaccines early enough so that they can be protected early on, because we still see all of the, for example, whooping cough. You still see that pretty often. I've had 2 patients just in the last 6 months who have had it, even with the vaccine, just because they were so young that their immune system hadn't had enough doses of it to protect themselves fully.
So there's a schedule. I mean, you kind of have a time course about what they're supposed to get and when.
Yes.
Every year I have to bring my kids to the office there and get one of you guys to sign the vaccination card because they can't go to school. And I now have a child in college, and even college-age kids get vaccines.
Yes.
Well, I guess we'll come back to that in a second. But one of the things we wanted to just talk about briefly was one particular vaccination that you and I were discussing was the role of human papillomavirus in children, in college-age kids, and in adults, and even later in life. And this really kind of affects both of our specialties, I think, so much. But as an ENT doctor, we see children, babies sometimes, with human papillomavirus, with recurrent respiratory papillomatosis, which is, I guess, a good way of saying warts along the vocal cord, and even into adults that have had squamous cell carcinomas of the oral pharynx. And the biggest change in otolaryngology, I think, from a vaccination standpoint in the past 20 years really has been the number of head and neck cancers that have been diagnosed that are human papillomavirus positive. Almost to the extent that, it is to the extent that when we go to conferences and we're talking about this, we'll have national leaders come on the podium and deliver a lecture and say, look, this was previously thought of as a sexually transmitted disease vaccine. And they'll stop and pause and say, this is not a sexually transmitted disease vaccine. This is a cancer vaccine. And the rates of vaccination in Alabama, they're pretty bad.
They are.
So can you speak to a little bit about the human papillomavirus vaccine specifically, and kind of tell us, the schedule, what, how many shots are there? Kind of give me your thoughts on that.
Absolutely. So I'll start with the fact that the human papillomavirus vaccine, HPV, it became available in 2006. And initially, insurances didn't cover it very well. It was only targeted for girls because initially when it came out, we thought that it was to prevent cervical cancer and vaginal cancer. And so it was against 4 strains of human papillomavirus. And human papillomavirus in itself, just to kind of sidetrack a little bit, there are more than 100 strains of HPV. Only a handful of them can cause cancer. Some of them cause warts, just like on your fingers or your toes, but they don't change into another strain. So if you get these particular strains, specifically 16 and 18, those usually lead to cancer, what we thought were cervical or vaginal cancer only. And so then we started to progress and thought, maybe we'll protect more girls if the guys get the vaccine too. And so then years later, insurances were covering it better. The boys were getting the vaccines too. And then now that it's been out for 12 years, you notice just in this article that we're looking at, this just came out in the last year. It's become more, now that we've seen more of it, we now know that it can, exactly like like you said, it can cause different types of throat cancer, different types of anal cancer as well, along with the vaginal and cervical cancer that we knew. So what the vaccine is now, there is a new vaccine that protects against 9 strains of HPV instead of 4. So now instead of protecting against about 70 to 80% of cervical cancer, it's now protecting against 90% of cervical cancer. And so what it is you can get it anywhere between 9 to now they just changed the recommendations. It used to be up to 26 years old. Now it's up until 40 years old. It only works as a preventative, though. So if you've already been exposed to the human papillomavirus, or if you've already had cancer just diagnosed with it, there's no point in getting the vaccine. That's why we're trying to push to get the vaccines. Like I said, you can get it as early as 9. Most people were trying to do it around 11 or 12 because that's when they come in for their 11 and 12-year-old vaccines before the 6th grade. So it's easy to go ahead and get it just when you're in the office anyways. If you are younger than 15 years old, with this new vaccine, the HPV 9, it's so effective that you can get 2 shots, one at initially and then 6 to 12 months later, the last vaccine. If you are older than 15 years old, then it's 3 shots over 6 months to be effective. And so we have really seen a huge decrease hearing back from the OBs. And we were talking earlier, I haven't seen as many cases as you have, obviously, of the squamous cell carcinoma from HPV in the throat. I can say that one of my partners over the last several years has seen one patient, a baby, who has had the recurrent respiratory papillomatosis. So it is important. It can be passed on to infants. It is rare, but it is possible to be passed on to infants during delivery if the mom has HPV. And that can cause just recurring bad problems, which you could probably speak more to.
I'm quoting this article here, but I think it's important to have this out there. But the article from JAMA, which is the Journal of the American Medical Association, Otolaryngology, Head and Neck Surgery, volume 144 in July of 2018. It says by 2020, the number of human papillomavirus positive oropharyngeal squamous cell carcinomas is expected to surpass those of cervical cancers. So we're really seeing a big explosion in this problem in the United States. I think we were talking earlier, there are other countries that have different vaccination programs, Australia being one of the better examples of a country that really has had a mandatory national policy toward vaccination for human papillomavirus, and they've seen a lot of benefits from that. So, I think that's one of the things where in the U.S. we have a great healthcare system, but there are other countries that have, done a lot of research and have good policies that are helping their patients in the population. One of the things I wanted to bring up and talk about was anytime you talk about immunizations, there's always that discussion that families have about, are there side effects from vaccinations? What are the risks of a vaccination? Because there are some. There's no question there are. But, you're a mother, you're a physician. What do you tell parents, moms, when they come in and they have questions about the safety of a vaccine?
That's a very good question. This is definitely something that I am passionate about because it works. And so what I usually tell parents when they have concerns about this is I know that these are concerns that you take seriously because you want what's best for your child. And I want what's best for your child too. And so one of the problems that we have this day and age in practicing medicine is that we hardly ever see these diseases anymore. I have one physician who was one of the ones that trained me during residency who is from the Northeast and had 2 of his childhood friends die from polio and then one that is paralyzed from polio. And so he always got very passionate about when parents were concerned about vaccines or didn't want to vaccinate because it's personal. He was old enough. He has seen all of these and lived through it. And just 2 years ago in Spain, there was the first diphtheria case that we've seen in a while, and the person died from it. And measles, we're seeing more of an outbreak now, and the ones who are immunocompromised or have some sort of transplant or the ones who are younger than a year old, those are the ones who are going to, honestly, more likely to die from measles but anyone can. It's a very serious problem. And even if you live from measles, there's a high risk of having deafness afterwards or neurological problems, along with some of these others that we protect against that can cause meningitis.
Let me interrupt you just for one second, because I want to be sure you touched on something there. I want to be sure that everybody kind of understands that. So children need vaccines. There's a lot of evidence to support doing that. But you said there's sometimes we don't want to vaccinate a child. You mentioned 2 cases with the child's health would be at risk, just so there's no confusion there.
Yes. So there are reasons to not vaccinate or to not give some specific vaccines. I was talking earlier, a lot of the vaccines, the vast majority are what we call dead viruses or dead vaccines. But there are some live vaccines, which are MMR and varicella and rotavirus. And what that is you're exposed to a tiny amount of the actual disease, which sounds scary, but it's really not, because it's a very small amount. But it just means that the body needs to be exposed to that small amount to make a strong enough immune response to fight it. So it's safe in all kids except if you are immunocompromised, meaning there's a certain age. So these live vaccines usually are not given younger than a certain age. And if you are, if you have some sort of transplant, you are considered immunocompromised. Or if you have an immune problem, and then you cannot get these specific vaccines.
So if a child is young enough that their immune system is not fully developed, you have to wait until they get certain live virus vaccines.
Correct.
Or if they have a medical problem, such as they've had an organ transplant, when they're getting medicine to kind of suppress their immune system, you don't use some of those vaccines.
Correct.
Can you tell us a little bit about the national safety? Like if they used to have a flu mist, my kids loved the flu mist. They hated the shots that was pulled off the market. Can you talk a little bit how they kind of nationally, how they monitor these things?
Yeah, absolutely. So there is a vaccine adverse event reporting system and a vaccine safety data link that physicians have access to. And so anytime we see an adverse event, which thankfully, knock on wood, I've never had to use this, but if we ever see some sort of adverse event from a vaccine, we report it nationally. The CDC reviews this regularly. And if there's any concerns of its efficacy or if any concerns of its safety, then they either change the vaccine or pull it from the market. And a couple of examples are, like we talked about, like you were saying, the flu mist. So 2 years ago, they found that in its 5-year review, the first 3 years, it was very effective. But for the last 2 years, it was actually negative 40% effective, meaning that it didn't help at all in preventing the flu.
So that's not a good vaccine.
No. So they pulled it off the market the last 2 years. This year, they changed it, and it's back on the market. So we'll see how this one does.
I'm excited because I've gotten the flu every year having had a vaccine, and I know it's helped me, but I'm glad to know that they're looking at the efficacy and how people are doing with that do get the vaccine.
Absolutely. We want to make sure that we are doing what's right for the child and that it's in a safe manner.
All right, one other question. So, you mentioned something about insurance earlier, and the most insurance were covering it, and the boys are starting to be covered as well. Let's say you have a patient, at least we're seeing a lot of people that have had super high deductibles. Are vaccines covered by their deductibles? Or if I'm a mom and I really want to vaccinate my child, and money is an issue for all of us, but what do you tell those folks? How do the insurances cover it? Can they get it through the health department? Kind of tell us what your experience has been.
So I would say about 99% of the insurances, especially now with the insurance reform that's happened over the last decade, I would say, these vaccines are covered. So for most people when they come in, not all, but most people, when they come in for what we call their well-child check or checkup, the vaccinations are part of that. Usually they don't even have a copay. It's usually all covered. There are some insurances where you do have a copay or some sort of deductible, but usually I would say 99% of the time we found that all the vaccines are covered by the insurance.
Okay, that's reassuring to know. So parents don't have to worry about that. It's going to be something that is deemed very important by their insurance companies as well. One other quick question for you. We were going to talk briefly about a concept that people have heard of, like herd immunity. We were talking about when not to vaccinate kids. Some people may hear of this. Can you tell us briefly like what herd immunity is when you hear that term? And that's H-E-R-D, not H-E-A-R-D like I heard you, but herd like in a horse herd, H-E-R-D, or cattle herd, H-E-R-D. What is that?
So this is basically herd immunity is what we rely on to protect our young children and the immunocompromised. It's kind of been misused lately in that some people who are now worried about vaccines or don't want to vaccinate their children are now relying on herd immunity to protect their kids. So what it is, it's the fact that it's kind of a gamble. So if you are living in an area such as Alabama where our vaccination rates, they can improve, but they are pretty good in comparison to other places like New York or California. If you are living in an area where most people are vaccinated, chances are measles, HPV, all of these things aren't going around as often as in places where there are not as many people vaccinated. An example of this is there are some countries who don't have access to some of these vaccines. And so those are where the epidemics are still occurring. And so it's basically herd immunity is relying on the people around you to be protected so that these viruses or bacteria are not close to your child, so that even though your child is not vaccinated, hopefully they won't be exposed to the real thing.
So if I have a child who has a serious medical condition that can't be immunized for the reasons we talked about, whether there is some type of immunological problem or they've had a transplant, I am really relying on everybody else in the population to get their shots, because if they don't get their shots, my kid can't get the vaccination and my kid is at higher risk. So really what we're kind of saying is not only are you protecting yourself or your child, I think everybody wants to protect their child. You protect your child, you're protecting yourself, but you're protecting somebody else's child as well.
Absolutely.
You think this is probably the most important thing that you do during the day, or one of the most important things?
I really do. We do it so much. And thankfully, honestly, a lot of our parents who come in, they trust us. We have that relationship, and they want what's best for their child, and we do too. And I really take the time whenever a parent has a concern. I mean, there's a reason they have that concern. I want to address it head on and reassure them that, yes, I'm not going to do anything to jeopardize your child's health, but vaccines are just that important. I mean, it's just changed everything about our life and living a long, healthy life. And yes, I am passionate about helping parents feel comfortable about that decision for their child too.
All right, last question. So you're a mom, you're a wife, you're a physician, you're a role model for women in the community, for physicians. Do you have any advice for young women, young girls who are starting out, they're in high school, they're in college, and they think they might want to go into a healthcare field? What advice would you give the young future female physicians of tomorrow?
I would say don't give up on your dreams, but also research it. I volunteered at children's hospitals when I was in middle school and high school. I asked as many physicians that I knew what their experiences were, from in the clinic to how you balanced your personal life to what you did on the weekends and what you enjoyed about it and what you would change. So I would say don't give up on your dream and find the niche that you want to be in and really make an educated decision towards what you want to do for the rest of your life. Because when you choose the right thing, it doesn't feel like a job. It's just fun.
That's great advice. Jennifer, you've been so helpful today with the show. You've given us a lot of great information. If anyone has any questions about vaccines, how can they get in touch with you?
I work at Children's Medical Group. Honestly, the best way to answer these questions, because everyone is going to have different individual questions or different personal stories that they want validated, make an appointment with myself or with your pediatrician, whoever you want. If you need to get in touch with us, we have 12 board-certified pediatricians in my office, and any of us would love to sit down and talk to you. So just call our office at 342-3810, and we'll be happy to talk to you. There's a website, too, and we have some information on there, and it's cmgdoctors.com. And also a good source to look up just general questions or answers to find about vaccines is the CDC website and also the AAP.org website. That's the American Academy of Pediatrics and the Center for Disease Control. They have really good, helpful information that's easy to navigate.
Thank you so much for joining us on the show today. We're honored to have you here, and we look forward to talking with you in the future.
Thank you very much.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.